Are you truly ready to handle endocrine disorders on the NCLEX? In this video, we're breaking down 50 high-level endocrine NCLEX questions designed for serious test takers, not beginners. These are the exact types of clinical scenarios that confuse most candidates. Thyroid storms, myxedema coma, DKA versus HHS, SIADH versus DI, adrenal crises, Cushing's versus Addison's, calcium imbalances, and more. But we're not just answering questions, we're dissecting them. You'll learn how to recognize endocrine patterns fast, how to eliminate high-quality distractors, how to prioritize like a real RN, and how to think at NCLEX level, not textbook level. Every question is explained clearly so you understand why the correct answer is right, and why the others are wrong. If you want to pass NCLEX on your first attempt, this is the level you must master. Let's get into it. Welcome to MCQs Master 101, where we train your brain to think like the NCLEX. Question 1. A client with suspected Addison's disease presents with weakness, hypotension, and hyperpigmentation. Which laboratory finding does the nurse expect? A. Sodium 150 milliequivalents per liter. B. Potassium 5.8 milliequivalents per liter. C. Glucose 180 milligrams per deciliter. D. pH 7.48. Answer: B. Potassium 5.8 milliequivalents per liter. Rationale: Addison's disease, primary adrenal insufficiency, causes decreased aldosterone, leading to potassium retention, hyperkalemia, and sodium loss, hyponatremia. Question 2. A client with Cushing's syndrome is at highest risk for which complication? A. Hypoglycemia. B. Hyperkalemia. C. Infection. D. Weight loss. Answer: C. Infection. Rationale: excess cortisol suppresses the immune response, increasing susceptibility to infection. Question 3. A post-operative thyroidectomy client reports tingling around the mouth and fingers. What is the nurse's priority action? A. Assess for Chopsteck sign. B. Administer levothyroxine. C. Lower head of bed. D. Check blood glucose. Answer: A. Assess for Chopsteck's sign. Rationale: tingling suggests hypocalcemia from accidental parathyroid removal. Chopsteck's sign assesses neuromuscular irritability. Question 4. A client with hyperthyroidism has a heart rate of 132 beats per minute and temperature of 103 degrees Fahrenheit, 39.4 degrees Celsius. Which condition is suspected? A. Myxedema coma. B. Thyroid storm. C. SIADH. D. Addisonian crisis. Answer: B. Thyroid storm. Rationale: severe hyperthyroidism with high fever and tachycardia indicates thyroid storm, a life-threatening emergency. Question 5. Which assessment finding is expected in hypothyroidism? A. Heat intolerance. B. Weight loss. C. Bradycardia. D. Exophthalmos. Answer: C. Bradycardia. Rationale: hypothyroidism slows metabolism, resulting in bradycardia, cold intolerance, and weight gain. Question 6. A client with diabetes insipidus has a urine output of 600 milliliters per hour. Which medication does the nurse anticipate administering? A. Regular insulin. B. Desmopressin. C. Mefimazole. D. Furosemide. Answer: B. Desmopressin. Rationale: desmopressin is a synthetic ADH used to reduce excessive urination in diabetes insipidus. Question 7. A client with SI-ADH has a sodium level of 118 milliequivalents per liter. Which intervention is priority? A. Encourage oral fluids. B. Administer hypertonic saline. C. Give desmopressin. D. Restrict sodium. Answer: B. Administer hypertonic saline. Rationale: severe hyponatremia, less than 120, can cause seizures and requires cautious hypertonic saline administration. Question 8. A client with type 1 diabetes reports shaking and diaphoresis. Blood glucose is 48 milligrams per deciliter. What is the nurse's first action? A. Administer IV insulin. B. Give 15 grams rapid-acting carbohydrate. C. Start D5W infusion. D. Call rapid response. Answer: B. Give 15 grams rapid-acting carbohydrate. Rationale: hypoglycemia, less than 70 milligrams per deciliter, requires immediate glucose intake if the client is conscious. Question 9. Which finding is consistent with diabetic ketoacidosis, DKA? A. pH 7.48. B. Blood glucose 65 milligrams per deciliter. C. Fruity breath odor. D. Shallow respirations. Answer: C. Fruity breath odor. Rationale: DKA causes ketone accumulation, resulting in fruity-smelling breath and metabolic acidosis. Question 10. A client with DKA is receiving IV insulin. Which lab value indicates treatment is effective? A. Potassium 6.0 milliequivalents per liter. B. Glucose 250 milligrams per deciliter. C. pH 7.36. D. Respiratory rate 32 per minute. Answer: C. pH 7.36. Rationale: normalizing pH 7.35 to 7.45 indicates correction of metabolic acidosis. Question 11. A client with hyperparathyroidism reports bone pain and recurrent kidney stones. Which laboratory value does the nurse expect? A. Calcium 7.8 milligrams per deciliter. B. Calcium 11.5 milligrams per deciliter. C. Phosphate 6.0 milligrams per deciliter. D. Potassium 3.0 milliequivalents per liter. Answer: B. Calcium 11.5 milligrams per deciliter. Rationale: hyperparathyroidism increases PTH secretion, causing bone resorption and hypercalcemia, leading to bone pain and kidney stones. Question 12. A client with hypoparathyroidism develops muscle spasms and positive Trousseau's sign. Which electrolyte imbalance is present? A. Hypercalcemia. B. Hypernatremia. C. Hypocalcemia. D. Hyperkalemia. Answer: C. Hypocalcemia. Rationale: low PTH reduces calcium levels, causing neuromuscular excitability and tetany. Question 13. A client with Graves' disease is prescribed methimazole. Which instruction is most important? A. Take with antacids. B. Report sore throat or fever. C. Avoid iodine-rich foods. D. Take on empty stomach. Answer: B. Report sore throat or fever. Rationale: methimazole can cause a granulocytosis. Sore throat or fever may indicate infection and requires immediate evaluation. Question 14. A client with myxedema coma is admitted. Which intervention is priority? A. Apply warming blanket rapidly. B. Administer IV levothyroxine. C. Restrict fluids. D. Encourage ambulation. Answer: B. Administer IV levothyroxine. Rationale: myxedema coma is severe thyroid replacement requiring immediate thyroid hormone replacement. Question 15. A client with type 2 diabetes is prescribed metformin. Which finding requires holding the medication? A. Creatinine 2.3 milligrams per deciliter. B. Blood glucose 210 milligrams per deciliter. C. HbA1c 8%. D. BMI 32. Answer: A. Creatinine 2.3 milligrams per deciliter. Rationale: metformin is contraindicated in renal impairment due to risk of lactic acidosis. Question 16. A client with pheochromocytoma is scheduled for surgery. Which medication is administered preoperatively? A. Propranolol before alpha blocker. B. Insulin infusion. C. Phenoxybenzamine. D. Hydrocortisone. Answer: C. Phenoxybenzamine. Rationale: alpha blockers are given first to control hypertension before adding beta blockers to avoid hypertensive crisis. Question 17. A client with DKA has a potassium level of 5.5 milliequivalents per liter before insulin therapy. What does the nurse anticipate after insulin administration? A. Potassium will increase. B. Potassium will decrease. C. No change. D. Sodium will increase. Answer: B. Potassium will decrease. Rationale: insulin shifts potassium into cells, lowering serum potassium levels. Question 18. A client with acromegaly complains of joint pain and enlarged hands. Excess secretion of which hormone is responsible? A. ACTH. B. TSH. C. Growth hormone. D. ADH. Answer: C. Growth hormone. Rationale: acromegaly results from excessive growth hormone secretion after epiphyseal closure. Question 19. A client with SIADH is on fluid restriction. Which finding indicates treatment is effective? A. Sodium 118 milliequivalents per liter. B. Urine-specific gravity 1.035. C. Sodium 138 milliequivalents per liter. D. Weight gain 2 kilograms. Answer: C. Sodium 138 milliequivalents per liter. Rationale: normalization of sodium 135 to 145 milliequivalents per liter indicates correction of dilutional hyponatremia. Question 20. A client with Addisonian crisis is hypotensive and confused. Which medication should the nurse administer immediately? A. Insulin. B. Hydrocortisone IV. C. Methimazole. D. Desopressin. Answer: B. Hydrocortisone IV. Rationale: Addisonian crisis requires immediate IV corticosteroids and fluid resuscitation to prevent shock. Question 21. A client with hyperthyroidism is prescribed propranolol. What is the primary purpose of this medication? A. Decrease thyroid hormone production. B. Block peripheral conversion of T4 to T3. C. Control tachycardia and tremors. D. Increase TSH secretion. Answer: C. Control tachycardia and tremors. Propranolol is a beta blocker used to control sympathetic symptoms such as tachycardia, palpitations, and tremors in hyperthyroidism. Question 22. A client with syndrome of inappropriate antidiuretic hormone, or SIADH, is at risk for which complication? A. Hypernatremia. B. Seizures. C. Polyuria. D. Dehydration. Answer: B. Seizures. Rationale: severe hyponatremia from water retention can cause cerebral edema and seizures. Question 23. A client with type 1 diabetes mellitus has Kussmaul respirations. What is the underlying cause? A. Respiratory alkalosis. B. Metabolic acidosis. C. Hypoglycemia. D. Hypernatremia. Answer: B. Metabolic acidosis. Rationale: In DKA, metabolic acidosis stimulates deep, rapid respirations to blow off CO2 and compensate. Question 24. A client with primary hyperaldosteronism or Conn's syndrome is expected to have which finding? A. Hyperkalemia, B. Hypotension, C. Hypokalemia, D. Hypernatremia. Answer: C. Hypokalemia. Rationale: excess aldosterone causes sodium retention and potassium excretion, leading to hypokalemia and hypertension. Question 25. A client newly diagnosed with hypothyroidism is prescribed levothyroxine. Which instruction is correct? A. Take at bedtime with food. B. Stop medication once symptoms improve. C. Take in the morning on an empty stomach. D. Double dose if a dose is missed. Answer: C. Take in the morning on an empty stomach. Levothyroxine is best absorbed on an empty stomach and should be taken consistently in the morning. Question 26. A client with diabetes mellitus has a fasting blood glucose level of 130 milligrams per deciliter. How should this result be interpreted? A. Normal. B. Hypoglycemia. C. Impaired fasting glucose. D. Hyperglycemia. Answer: D. Hyperglycemia. Rationale: fasting glucose greater than or equal to 126 milligrams per deciliter is diagnostic of diabetes and indicates hyperglycemia. Question 27. A client with pheochromocytoma experiences severe headache and blood pressure of 210 over 120 millimeters mercury. Which intervention is priority? A. Encourage deep breathing. B. Administer IV antihypertensive. C. Restrict fluids. D. Place in Trendelenburg position. Answer: B. Administer IV antihypertensive. Rationale: hypertensive crisis from catecholamine excess requires immediate blood pressure control. Question 28. A client with diabetic neuropathy reports numbness in the feet. Which instruction is most important? A. Soak feet daily. B. Walk barefoot at home. C. Inspect feet daily. D. Trim nails very short. Answer: C. Inspect feet daily. Rationale: neuropathy decreases sensation, increasing risk of unnoticed injury and infection. Daily inspection prevents complications. Question 29. A client with Cushing's syndrome has purple striae and central obesity. Which additional finding is expected? A. Hypotension. B. Moon face. C. Weight loss. D. Hyperkalemia. Answer: B. Moon face. Rationale: excess cortisol causes characteristic fat redistribution, including moon face and truncal obesity. Question 30. A client with diabetes insipidus is receiving desmopressin. Which finding indicates the medication is effective? A. Urine output 50 milliliters per hour. B. Sodium 155 milliequivalents per liter. C. Urine specific gravity 1.001. D. Increased thirst. Answer: A. Urine output 50 milliliters per hour. Rationale: desmopressin reduces excessive urination. Normal urine output, 30 to 50 milliliters per hour, indicates effectiveness. Question 31. A client with type 1 diabetes becomes unconscious. Blood glucose is 32 milligrams per deciliter. What is the nurse's priority action? A. Administer subcutaneous insulin. B. Give oral glucose tablets. C. Administer IV dextrose. D. Start normal saline infusion. Answer: C. Administer IV dextrose. Rationale: an unconscious client cannot take oral glucose. IV dextrose is the fastest and safest treatment for severe hypoglycemia. Question 32. A client with hyperthyroidism is scheduled for radioactive iodine therapy. Which instruction is appropriate? A. Expect immediate symptom relief. B. Avoid close contact with others temporarily. C. Increase iodine intake. D. Stop beta blockers permanently. Answer B. Avoid close contact with others temporarily. Rationale: radioactive iodine emits radiation. Temporary isolation precautions reduce exposure to others. Question 35. A client with Cushing's syndrome has blood glucose of 280 milligrams per deciliter. The nurse understands this occurs due to A. Increased insulin sensitivity, B. Increased gluconeogenesis, C. Decreased cortisol, D. Excess ADH. Answer B. Increased gluconeogenesis. Rationale: excess cortisol increases glucose production and causes insulin resistance, leading to hyperglycemia. Question 34. A client after thyroidectomy develops stridor. What is the nurse's priority action? A. Check serum calcium. B. Reposition client. C. Prepare for emergency tracheostomy. D. Administer morphine. Answer C. Prepare for emergency tracheostomy. Rationale: stridor indicates airway obstruction, possibly from laryngeal edema. Airway management is the priority. Question 35. A client with diabetes mellitus reports polyuria, polydipsia, and polyphagia. These symptoms are primarily caused by A. Hypoglycemia, B. Cellular starvation, C. Excess insulin, D. Low cortisol. Answer B. Cellular starvation. Rationale: despite high blood glucose, cells cannot utilize glucose effectively, triggering hunger and excessive urination and thirst. Question 36. A client with SIADH has confusion and headache. Sodium is 115 milliequivalents per liter. Which order should the nurse question? A. Fluid restriction, B. Seizure precautions, C. Hypotonic IV fluids, D. Strict intake and output. Answer C. Hypotonic IV fluids. Rationale: hypotonic fluids would worsen hyponatremia and increase risk of cerebral edema. Question 37. A client with acromegaly is at risk for which cardiovascular complication? A. Hypotension, B. Cardiomegaly, C. Bradycardia, D. Heart block. Answer B. Cardiomegaly. Rationale: excess growth hormone can enlarge the heart, leading to cardiomyopathy and heart failure. Question 38. A client with Addison's disease is teaching about stress management. Which statement indicates understanding? A. I will stop steroids when I feel better. B. I should increase my dose during illness. C. I should avoid salt in my diet. D. I don't need medication if I'm asymptomatic. Answer B. I should increase my dose during illness. Rationale: stress or illness requires increased corticosteroid dosing to prevent Addisonian crisis. Question 39. A client with diabetic ketoacidosis has blood glucose of 520 milligrams per deciliter and potassium 3.2 milliequivalents per liter. What should the nurse anticipate before starting insulin? A. Administer potassium. B. Give sodium bicarbonate. C. Restrict fluids. D. Administer calcium. Answer A. Administer potassium. Rationale: insulin lowers potassium further. If potassium is low, less than 3.3, it must be corrected first to prevent arrhythmias. Question 40. A client with hypothyroidism reports extreme fatigue and cold intolerance. Which additional finding is expected? A. Diarrhea. B. Warm, moist skin. C. Constipation. D. Tachycardia. Answer C. Constipation. Rationale: slowed metabolism in hypothyroidism decreases GI tract motility, causing constipation. Question 41. A client with type 2 diabetes is prescribed insulin glargine at bedtime. What is the primary purpose of this insulin? A. Rapid glucose correction. B. Mealtime coverage. C. Basal glucose control. D. Treat hypoglycemia. Answer: C. Basal glucose control. Rationale: insulin glargine is long-acting insulin that provides steady, peakless basal coverage over 24 hours. Question 42. A client with thyroid storm is receiving propylthiouracil, PTU. What is the action of this medication? A. Stimulates TSH release. B. Blocks thyroid hormone synthesis. C. Destroys thyroid tissue. D. Increases iodine uptake. Answer: B. Blocks thyroid hormone synthesis. Rationale: PTU inhibits thyroid hormone production and also reduces peripheral conversion of T4 to T3. Question 43. A client with diabetes insipidus is at risk for which acid-base imbalance? A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. None, typically normal. Answer: D. None, typically normal. Rationale: diabetes insipidus primarily causes fluid imbalance and hypernatremia, but does not directly cause acid-base disturbance. Question 44. A client with Cushing syndrome is at increased risk for impaired wound healing due to A. Decreased cortisol. B. Protein breakdown. C. Hypoglycemia. D. Hypercalcemia. Answer: B. Protein breakdown. Rationale: excess cortisol promotes protein catabolism, weakening skin integrity and delaying wound healing. Question 45. A client with hypothyroidism has a TSH level of 8 MIU per L. How should this be interpreted? A. Normal thyroid function. B. Hyperthyroidism. C. Undertreated hypothyroidism. D. Thyroid storm. Answer: C. Undertreated hypothyroidism. Rationale: elevated TSH indicates insufficient thyroid hormone replacement or untreated hypothyroidism. Question 46. A client with DKA has blood glucose 480 milligrams per deciliter and arterial pH 7.20. Which IV fluid is initiated first? A. 0.45% normal saline. B. D5W. C. 0.9% normal saline. D. Lactated ringers. Answer: C. 0.9% normal saline. Rationale: isotonic saline is given first to restore circulating volume before insulin therapy. Question 47. A client with hyperparathyroidism is advised to increase which intake? A. Calcium. B. Vitamin D. C. Phosphate. D. Fluids. Answer: D. Fluids. Rationale: increased fluids help prevent kidney stones caused by hypercalcemia. Question 48. A client with Addison's disease reports dizziness upon standing. This is primarily due to A. Hyperglycemia. B. Hypernatremia. C. Hypotension. D. Hypercalcemia. Answer: C. Hypotension. Rationale: low aldosterone leads to sodium and fluid loss, causing orthostatic hypotension. Question 49. A client with SIADH has urine osmolality of 600 milliosmoles per kilogram. What does this indicate? A. Dilute urine. B. Concentrated urine. C. Kidney failure. D. Normal finding. Answer: B. Concentrated urine. Rationale: SIADH causes excessive ADH secretion, leading to concentrated urine and water retention. Question 50. A client with long-standing diabetes has microalbuminuria. This finding suggests A. Liver failure, B. Early nephropathy, C. Neuropathy, D. Retinopathy. Answer B. Early nephropathy. Rationale: microalbuminuria is an early sign of diabetic kidney damage and requires tight glucose and blood pressure control. If you made it to the end of this video, you're not just studying, you're preparing at a different level. Endocrine questions are not about memorization, they're about recognizing patterns, understanding physiology, and making safe clinical decisions under pressure. That's exactly how the NCLEX tests you, and that's exactly how we train here. If this video sharpened your thinking, don't stop here. Subscribe to MCQs Master 101. Turn on notifications. Drop a comment with the topic you want next, and share this with a serious NCLEX candidate. Remember, the goal is not just to pass. The goal is to walk into that exam confident, calm, and clinically sharp. I'll see you next week.